लेके आओ. So today our class is about infective hepatitis or viral hepatitis, you can say. So there are certain terms you should be aware. So infection of the liver, it can happen by two kind of viruses. Few viruses are totally dedicated to liver, no other infection. They will infect only the liver. And these viruses are called hepatotrophic viruses. They infect only liver. So they are called hepatotrophic viruses. And these are from A to E. Now if you say DM, they may extend the classification. I go like that. Okay, but A to E is usually we are dealing with, and you should remember this, that A, B, C, D, E, these are five hepatotrophic viruses commonly. We see and read about them. So we'll see their specificities, their immunology, their clinical presentation. Okay. So other non-hepatotrophic viruses can also affect the liver, but their base, their main affection will be somewhere else, and liver is involved not 100 times, all the times. Occasionally they may affect the liver also. So these are the like viruses only. Epstein-Barr virus, EB virus we commonly call CMV, that is cytomegalovirus, or herpes simplex viruses, measles, Ebola, other many multiple viruses. These are common viruses. They infect other parts of the body predominantly, but sometimes they can affect liver also. So never forget when you are investigating or dealing with a case of hepatitis, not only A, B, C, D, E viruses, but there may be other viruses which are non-hepatotrophic. Yani they affect side by side liver also, but not 100 times. All the time they will not affect. Only on certain occasions. Silence, please. So we'll say this. So you can see the hepatitis A, B, C, D, E. They have got different characteristics by which they can be sought out. With which kind of infection is there, we can deduct out, or we should remember their characteristics. So hepatitis A. So there may be A and E. Both are almost similar viruses. Most of the time we are having A or E. B and C are chronic viruses, chronic hepatitis, which lead to chronicity. Though they can cause acute hepatitis, most of the time we encounter them when they are already old. Okay. And these viruses only when they can affect only people affected with the hepatitis B. So B will never occur in isolation. It will not occur with A or E or C virus, but only along with the B. So D is only when you get some patient of hepatitis B, you are giving treatment, and still patient is not recovering. Think about is there any hepatitis B also affecting this patient simultaneously? So A and E usually acute, more severe. A is usually less severe, E is more severe, particularly when associated with the pregnancy. So any patient with pregnancy and comes with hepatitis, please rule out hepatitis E virus also. Because when its course may be prolonged to the patient and patient may be more sick as compared to hepatitis A. It is not that every time a patient, a pregnant lady comes to you with hepatitis is only E. Chances that E should be ruled out first. Again, the hepatitis A is more common, but it should be ruled out. Silence, please. Again, no third warning. So their incubation period is differing, 2 to 6 weeks. Hepatitis A and hepatitis E, 2 to 6 weeks. एक से डेढ़ महीना, sometimes 2 months only. But in hepatitis B, suppose a person has come into contact with hepatitis B patient, or you have got a person who has received either the blood product which is infected with hepatitis B, or some needle stick exposure, a compounder nurse who is treating the patient in the ward, giving injection, accidentally, when the patient's status is not known whether he is suffering from hepatitis B or C, they may get infection by accidental prick of the injections. So they can get hepatitis. So आज उसको needle prick हुआ तो almost 1 month to 6 months later they may develop. This is the usual incubation period in B and C. So this is the time period, the incubation period, when they will present you with the symptoms. The risk group, what is the risk group for the patient to get hepatitis A, B, C, D, E? So A and E, as I told you, these are mostly fecal group. Residents of travelers of endemic region, children and caregivers in daycare centers. So fecal route, किसी के हेपेटाइटिस ए हो गया, कहाँ से हुआ? सब रेस्टोरेंट से भोजन लिया उसने, और लोगों ने जो लिया, दे कैन आल्सो गेट दिस. घर में किसी के हेपेटाइटिस ए हो गई, जब तक सिम्टम आए, दे आर preparing food for you. Chances are you may get also that, because patient के भी कोई symptoms नहीं आए, तो he is continuing cooking and you are consuming that. So a patient who is living in a home where already one person is hepatitis A positive, otherwise other family members may also get this infection. A and E is like that. So fecal-oral route is common. In hepatitis A, there's a zoonosis. Big forms, if they are caring for other animals, they also may carry this infection and may infect the handlers of the animals. So hepatitis B and C, usually there is transmission by the parenteral route. Parenteral route means IV injection, iron injection, IV blood products, IV blood itself, blood component means, okay, or sometimes sexual route. So hepatitis B and C will transfer only by parenteral route, never by eating food. Not by eating food or fecal-oral route. It is definite they affect only by transmission, accidental exposure, needle stick exposure, or receiving hepatitis B blood. Patient किसी का hepatitis B आ गया, उसके symptom नहीं आए, laboratory में negative आ गया, patient के लग गया, तो he and the patient both may develop hepatitis B later on. So multiple sexual partners also is a risk factor. MSM, man having sex with man, homosexual people. New term is man having sex with man, MSM. So they may also get hepatitis B infection, hepatitis C infection. Infants born to infected mother. Female patient गांव में आप देते हैं, कोई टेस्ट की सुविधा नहीं, CBC hemoglobin कर लेते हैं खाली, even CBC not available sometime. So patient they are sent home, आपका hemoglobin ठीक है, you enjoy. They don't know their hepatitis B status. When giving childbirth, even then if not tested, then that infected mother can transmit. Still the mother has not developed jaundice, clinical jaundice. She doesn't remember. Even jaundice थोड़ी बहुत हुई भी, तो सब झाड़ा वाड़ा लगा लिया. Patient became all right and no further treatment, no further testing. Patient lands up in delivery room, delivery हो गया, and baby will be transmitted hepatitis B along with the mother. Okay, so these are the risk groups only. Hepatitis C, even they say Another thing is transplant recipient patient. So any organ like liver transplant or renal transplant, most common one. If you do not check for hepatitis B, they may be transmitted to the recipient, to the patient. So fatality rate, we'll see. So incidentally, they got very low fatality rate, particularly A and E, very low fatality rate, less than 1%, 1% like that. Even in hepatitis B, they say only 1% people may die of acute hepatitis B infection. Rarely, later on complication may occur because nowadays good treatment available. Still one wonderful thing in our times, there are no treatment for hepatitis C. No vaccine is still available for hepatitis C. But still, patient, nowadays reverse has happened. Previously, used to say it is better to have hepatitis B. Now they say it is better to have hepatitis C because treatment is available for hepatitis C. And once treatment is completed, probably no recurrence and patient will be cured. But in hepatitis B, lifelong treatment you have to get. Nowadays, this is the problem. You give treatment for 1 year, 2 year like that, still there are chances that patient will have again recurrence of the infections. थोड़ा बहुत जो वायरस बच गया उसके बॉडी में again they may grow and again there will be recurrence of the hepatitis B. So these people have to be under care of the hepatologist for whole life. They have to get it checked every time for their liver enzymes and hepatitis B level. But for hepatitis C, once you treat it, most probably you are cured. There is cure rate more in the hepatitis C. Carrier state. Again, A and E, waterborne diseases are food, water, fecal route, almost 100% cure. There is no carrier state. Hepatitis B, C, and D, all by transmission, parenteral route, in the blood itself. They have got carrier state. They can transmit the infection to the partner or to any other person to whom they are giving blood or organ transplant. So they can transmit the infection. So there is carrier stage in the B, C, and D, but not in A and E because they are fecal route. एक बार खाया हो गया इन्फेक्शन, आपने दवाई दी, he becomes okay, खलास, recovery 100%, almost 100%. Chronic hepatitis, same condition only. A and E, no chronic hepatitis. Rarely hepatitis B में हो सकती है, लेकिन not in, but chronic hepatitis known in B and C and D. Once they occur, as I told you, कि acute state, nobody doubt about this B, C and D. You get it tested. Suppose कि negative ही आ गया first time में, you will never go for another test. But when they come to you again, then they may get positive for the hepatitis B and C. That means their chronicity has developed. We'll see other features of these. Cirrhosis again, as I told you, acute stage A and E, no cirrhosis. कोई long term complication नहीं है. Medicine दिया, recovery almost. There is no specific medicine. A and E. No antiviral treatment for A and E. Symptomatic management. So there is, because why? Because there is no cirrhosis. There is no long-term complication. It is acute only. Once you treat it, it recovers by itself. No specific medicine. But for B, C, D, they are chronic hepatitis mostly. Acute हो जाएगा. Then once they go into chronicity, they will develop cirrhosis. They can develop liver cancer also. So they have to be taken care of, these things. So there is no cirrhosis in A and E, but yes, in B, C, D, there is phase of cirrhosis. So what is definition of acute hepatitis? It is defined by an array of symptoms that may vary from the mild non-specific symptoms. The patient may come to you only say बुखार हो गया मुझे तो. There is mild general symptoms. बदन में दर्द हुआ, जोड़ भी दुख रहा है, you are thinking about the dengue fever or ब्रेक बोन फीवर सा, चिकनगुनिया तो नहीं हो गया इसके. It is not so. Any viral infection, when severe phase, it may give rise to arthralgia, myalgia, severe headache. ठीक है. There is another term, acute or fulminant hepatic failure. It is defined as rapid development of severe liver injury along with encephalopathy. Jaundice तो है इसके, also severe है तो कोagulopathy भी हो गई उसके. ठीक है ना. विदाउट प्री एग्जिस्टिंग लिवर डिजीज, उसके पहले कोई नॉन क्रॉनिक लिवर डिजीज नहीं है, यानी acute fulminant hepatic failure है उसके. And it is usually within 6 months of the from the onset of the infection. So before 6 months of infection of hepatitis, when we see it severe, it may go into acute fulminant hepatic failure. Don't think hepatitis B खाली chronicity कर दे, साल हो गया, infection हो गया. It will be treated. Even acute phase very common in hepatitis B. Now we have got many tests even in peripheries. We can diagnose hepatitis B हो गया उसके. We can treat them, and fatality rate is luckily low as in general. But once there severe hepatic fulminant failure is there, mortality rate will be high. 10 to 20% people may die. So we have to be careful. So hepatitis A in general, what do we say? It is an RNA virus. Hepatitis B is DNA virus. So HIV is an RNA virus and is in the family of picornavirus family, and it is transmitted by fecal-oral route. It is the most common cause of acute viral hepatitis world over. Not all in India, not only in India, but also all over the world. This is the most common hepatitis से पहले टेस्ट करना है. यूजुअली करनी जरूरत नहीं पड़ती है, 4-6 हफ्ते में पेशेंट ठीक हो जाता है. We usually don't go for, but nowadays say if person is with money, he want to know why this has happened to me, which virus is this, I want to get full treatment. So we will go for HIV, anti-hepatitis A virus immunoglobulin levels. So it's large scale outbreak because fecal है, कहीं आप पार्टियों में गए, महाकुंभ में चले गए, कहीं ऐसे गैदरिंग में चले गए जहाँ इन्फेक्टेड फूड अगर सर्व हो गया, large outbreaks will be there, not single case. मगर डे में आके आप जैसे दिल्ली में बैठे हो तो रोज के 2-4 हजार पेशेंट नए पैदा हो रहे हैं पूरे दिल्ली में. समझ लो आप सफदरजंग में बैठे हो, more than 100 cases of hepatitis A coming to you with jaundice, and suddenly you are on alert. Higher authority will be alert. Health authority will be alert कि क्या हो गया, कहाँ से आ रहा है. So usually large outbreak happens. The vaccine is available. This is for later only. We are here only discuss about the epidemiology and the clinical features. The viral shedding in the infected patient species continues for 2 to 3 weeks after onset of symptoms. वो इन्फेक्टेड थी तो उसकी सिम्टम आने के 15 दिन पहले से ही स्टार्ट हो जाएगा. उससे हल्का हल्का बुखार, बदन में दर्द हो रहा है. Nobody know, even patient doesn't know that मेरे को फीवर होगा या नहीं होगा. He is complaining only the general body ache. So 15 days before onset of symptoms, this one full blown jaundice, we have only this symptom, mild only. तब से वो infective है. Even without symptom, he may be infective to others. सपोज उसने खाना बनाया, उसको हेपेटाइटिस ए कहीं से लगा, उसने भी खाना बना के खिला दिया किसको, he will also develop he is also carrier and he can transmit to that. और फुल ब्लोन सिम्टम्स आ गए, 2 हफ्ते तक सिम्टम चले, अप टू अभी पेशेंट आपसे पूछ सकता है सर मैं खाना बनाऊं या नहीं बनाऊं. आप एटलीस्ट एडवाइस हम तुम्हारे सिम्टम जब तक पूरे सेटल नहीं होगा 15 दिन बाद तक भी मत बनाना आप. सो आफ्टर क्लियरेंस ऑफ डिजीज इवन 15 days you have to give rest to the patient. You don't make any food or don't give water to anybody else. पानी में तो ऐसा उंगलियां डाल के देते हैं लोग, इस तरह का नहीं. You should not serve water to others. So infectivity continues 2 to 3 weeks after the onset of this symptom. So HIV can be silent, subclinical. जरा बुखार, खांसी, जुकाम, हल्का सा उसको jaundice हो. Now what is normal level of bilirubin in a person? Can anybody? Any guess? No scolding, nothing. What is the level of bilirubin in the serum? You are 30th, third MBBS. Seen any case of jaundice in ward? Anybody has said? See, don't open your mobile. It's not exam. So usually it is 1 to 1.4 milligram maximum total bilirubin. How many bilirubins are there in the body? Hmm? टोटल बिलीरुबिन कितने में डिवाइड होता है? कैसे क्लासिफाई करते हैं? कॉन्जुगेटेड एंड अनकॉन्जुगेटेड. कॉन्जुगेटेड किसको बोलते हैं अपन? क्या क्वालिटी होती है? इट इज कॉन्जुगेटेड का मतलब क्या हुआ? कॉन्जुगेटेड का मतलब है उसने ग्लूकोरोनिक एसिड के साथ में कॉन्जुगेट कर लिया. नाउ इट हैज बिकम soluble type of bilirubin, so it can pass through out of the body. But unconjugated or indirect bilirubin is not conjugated till now, so it will remain in the body. It is fat soluble but not water soluble. ठीक है. तो दो तरह के bilirubin दोनों का टोटल वैल्यू 1.4 मैक्सिमम मानते हैं अपन. 1.5 से ज्यादा हो तो वी से इट इज जॉन्डिस. व्हेन दिस जॉन्डिस अपीयर्स इन द बॉडी, कितने लेवल पे अपन देख सकते हैं बॉडी में? मोर देन 2. सो इट्स गुड. मोर देन 2 मिलीग्राम हो सकता है तो देन you can find jaundice in a person's eye. Where we see jaundice? कंजक्टिवा में देखते हैं, then लोअर कंजक्टिवा में देखते हैं. लोअर में देखते हैं, लोअर में तो एनीमिया देखते हैं, ऊपर वाले में देखते हैं शायद, अपर कंजक्टिवा में. हाँ. So when bilirubin reach more than 2.5, this depends upon how much alert you are. Secondly, what are the conditions? Where you can find the jaundice appear? Examination, what condition should be there? Where we should look for jaundice? In what condition? How we can best look for jaundice? What should be the condition during clinical examination? It should be seen in better bright daylight. अगर आप पेशेंट खिड़की से दूर है, खिड़की तक लेगा उसको, सी इज कंजक्टिवा, देन यू विल बेस्ट फील फॉर द जॉन्डिस. अगर आप उसको बिल्कुल जैसे यहाँ बाहर खिड़की है, यहाँ बैठे आपको नहीं पता पड़ेगा. आर्टिफिशियल लाइट इज नॉट गोइंग टू हेल्प मच. पीछे से ब्राइट लाइट आ रही है, यू कैन सी इट, बट बेस्ट इज विद ब्राइट डे सनलाइट. सो आप खिड़की के पास में ले जाओ. अगर वार्ड ग्राउंड फ्लोर पे थोड़ा बाहर ले गए पेशेंट को वार्ड में, यू कैन सी when it is best visible. So best visible during daylight, not during evening or night time. आप रात को राउंड लेने आ रहे हो, you cannot appreciate jaundice unless 4-5 पहुंच गई, then only you will be able to appreciate. भाई साहब इसके तो jaundice हो रखी है. ठीक है. So physical examination may reveal jaundice. Sometimes liver enlargement, that is hepatomegaly in rare cases. Sometimes you may find lymphadenopathy, rarely splenomegaly or vascular rash. So patient के jaundice के साथ में you can, तो liver का hepatitis है तो there will be liver enlargement, sometimes tender hepatomegaly may be there, and rarely you may find spleen also enlarged and lymph node also enlarged. Sometimes rash only, particularly fair skin वालों में. Dark skin वालों में आपको you may not see the rash. Very rare it is. We don't look for the rashes in our practice usually, but in foreign country mostly they are white skinned. So appreciation of rash is more good there. You can appreciate rash in them. So how we diagnose HIV? By detection of IgM antibody against HIV, that is hepatitis virus, the anti-HIV and IgM type of antibody. What is the IgG and IgM antibody? Can anybody tell me what is the difference between IgG and IgM antibody? Anybody? Very good. So IgM comes early in acute phase, and when infection is going, when it has become chronic, then IgG antibody. So recovery phase and immunity phase are characterized by presence of IgG antibody. In case of hepatitis A, if IgG antibody is positive, that means he had infection in past with the hepatitis A virus. So, and if IgG is present, that means he has developed now immunity to hepatitis A. So, recurrent infection will be less common in that patient, not altogether impossible, but very rare time because his patient has now developed immunity. So, IgG will determine whether the patient will get again infection or not. And along with this, when IgG comes, the IgM will decline now. Within 6 months, IgM will be more prominent. During IgG, 6 months के बाद में IgG डेवलप होगी, इसकी लेवल बॉडी में कम होती जाएगी. अगेंस्ट हेपेटाइटिस ए वायरस, IgM level will start dropping. Since it is acute only, no chronic phase, no complication, no cirrhosis, no cancer, liver cancer, liver biopsy is usually not indicated, rarely needed. Fulminant hepatic failure or FHF is rare, but the risk increases with the age. In the younger people, less than 15.1% only. Person older than 40, it will increase to 1%. 100 में से एक आदमी हो सकता है if fulminant hepatic failure है तो he can die. Person younger than 15, 1000 में से एक को they may die of fulminant hepatic failure with the hepatitis A. Now we will look for the hepatitis B virus. It is a DNA virus in the Hepdna-virus family. So इसके भी जीन्स होते हैं, मल्टीपल जीनोटाइप्स होते हैं. एचबीवी के 8 जीनोटाइप होते हैं, ए टू एच, ए बी डी. हेपेटाइटिस ए के बी वायरस के भी ए टू एच 8 जीन्स होते हैं. वो देयर इंसिडेंस लेवल इज डिफरिंग. मोस्ट कॉमन विल बी ए, फिर बी, सी, ये ज्यादा कॉमन होते हैं. डी, ई, एफ, जी, एच दे आर रेयर. एंड देन वी सेपरेट पॉकेट्स ऑफ द आर सेपरेट डिवीजन से. अपने यहाँ जैसे चलो साहब ये नॉर्थ में ज्यादा, राजस्थान में ज्यादा कॉमन है, तो साउथ में साहब ये वाला कॉमन है. तो इस तरह से जो यूनाइटेड स्टेट्स की अपन किताब पढ़ते थे वैसे ही बताए थे. देयर इंसिडेंस इन डिफरेंट पॉकेट इज डिफरेंट ऑफ डिफरेंट वायरस. Modes of transmission, it is vertical. As I described to you, mother to infant. Patient if not never tested for hepatitis B comes to delivery, it will transmit infection to the baby. ठीक है ना? And this is called vertical transmission. Horizontal means person to person. Some male is with hepatitis, one partner is hepatitis B positive, another is not. They may transmit horizontally. आप blood आपने लिया किसी कंपाउंडर ने, या accidentally you are doing some procedure, you have accidental needle prick, you may get hepatitis B. That is horizontal transmission. Vertical is only one direction. Direct contact with the blood are open source of the infected person, and sexual contact with an infected person. Rate of progression from acute to chronic hepatitis B. Hepatitis B chronic कब होता है? Is approximately 90% for a perinatal. यानी मदर से चाइल्ड में आएगा. 90% chances है if you don't give immediately the immunoglobulin and hepatitis B vaccine to the baby, 90% chances are they will develop, transmit the infection. Infection will be, baby will be infected in 90% of cases with born from a infected B patient. But it only 20 to 50, half of the incidence of transmission if patient is 1 to 5 years. अगर उसको इन्फेक्शन हो गया तो क्रोनिसिटी का वैल्यू सिर्फ 20 to 50%, but 20% to 50% quite great range, because in adult they got good immunity. 95% of patients having hepatitis B positive at surface antigen. Only 5% will develop chronic hepatitis B. Rest 95% will clear the infection without any medication. So, we usually do not prescribe any antiviral therapy to the hepatitis B patient. We will go for after 6 months, we will check for the immediately you have to immunization. If you got accidental injury, you or some other relative or nursing staff, better not it is advisable to take immunoglobulin injection at the spot. Within 24 hours, he should receive that. Otherwise, chances are he will get hepatitis B virus when you are checking after 6 months कि क्लियर हुआ कि नहीं हुआ 5% केसेस में क्लियर नहीं हुआ then you have to start the therapy for chronic hepatitis B. So transmission is only 5% in adult, but 20 to 50% in young children, 1 to 5-year-old, and 90% in perinatal cases from mother to baby. 90% chance are that he will develop hepatitis B. Acute hepatitis B treatment is rarely needed unless there is severe hepatic, that is FHF we call, prolonged jaundice, coagulopathy, encephalopathy, then it is labeled as FHF, that is fulminant hepatic failure is going there. Diagnosis against, there are 4 clinical phases. If you can remember good only, there is immune tolerant, immune active. Inactive phase and reactivation phase. So, immune tolerant, immune active, inactive phase, immune reactivation. Extrahepatic manifestation may also be there in hepatitis B patients. Always ask history from the patient with jaundice. क्या तुम्हारे जोड़ों में दर्द होता है लाइक पोलियार्ट्राइटिस नोडुला हो सकता है ग्लोमेरुलोनेफ्राइटिस के यूरिन में ब्लड आ रहा है उसके आरबीसी पॉजिटिव है क्रायोग्लोबुलिनीमिया हो सकता है उसके सीरम सिकनेस लाइक जॉइंट पेन आर्थ्राल्जिया रैशेस दीस आर सीरम सिकनेस लाइक इचिंग हो सकती है ना मेम्ब्रेनस नेफ्रोपैथी सीवियर टाइप ऑफ क्रिएटिनिन एंड यूरिया में भी राइज इन पेन membranopolysaccharides more severe type of glomerulonephritis may be there and papular ectodermatitis, that is papular eruptions on the extremities, in the distal part of the extremities. ये हाथ और पैरों में उसके papular rashes आ सकते हैं. It's more prevalent in children. So again, there are certain tests by which we have to send for a patient is coming with the chronic hepatitis B. We have to send so many tests to see in what stage patient is, whether he is acute hepatitis B virus, real हो गया कि नहीं हो गया infection, whether he is immune tolerant or he is immune active and low replication chronic hepatitis B, or patient is कोई किसी का आपको HBsCG ये आ गया anti hepatitis B surface antigen only. Now you don't know, you have to take history. So if only this one is positive, rest absent, probably is having hepatitis. So anti-hepatitis B surface antigen positive है उसमें, that is due to vaccine immunity only. There is no hepatitis B surface antigen नहीं है, but antibody alone is there. Then probably he will develop immunity to the hepatitis B. Vaccine वाला आदमी है, vaccine लग चुकी है उसके. Hepatitis C, again RNA virus. So B is DNA virus, A or C is, it is RNA virus. So it is flavivirus groups, again 6 genotype होते हैं, इनका importance है treatment में, hepatitis C के treatment में. Different combination of drugs are given. Hepatitis C is seen there, genotype. Hepatitis C की कौन सी genotype है, वो hepatologist should send this for genotyping. उसके हिसाब से दे विल प्रिस्क्राइब द ट्रीटमेंट. बट नाउअडेज एक जनरलाइज ट्रीटमेंट है, कोई सी भी आपकी क्लास हो, यू कैन गिव दैट सोफोस्बुरिक आती है ट्रीटमेंट, इसके साथ एक आती वायरल, सो डायरेक्टली यू कैन प्रिस्क्राइब दैट. सो मोस्ट फ्रीक्वेंट मोड ऑफ ट्रांसमिशन इज पेरेंटल. अगेन लेस कॉमन मोड ऑफ ट्रांसमिशन इज हाई रिस्क सेक्सुअल प्रैक्टिस एंड पेरिनेटल ट्रांसमिशन. सो हेपेटाइटिस सी किसी महिला के या पुरुष के है तो transsexually transmission के chances compared to hepatitis B, they are quite less. एज वेल एज पेरिनेटल ट्रांसमिशन के चांसेस जहाँ 90% बूढ़े होते हैं विदाउट ट्रीटमेंट, इनमें थोड़े काफी कम होंगे। हेपेटाइटिस सी पेशेंट के तो मान लो 10 या 15 पेशेंट बच्चों के हेपेटाइटिस सी डेवलप हो सकती है। Also similar with the organ transplantation. So transmission by transfusion of blood product and organ transplant, because we always work up, we go for the hepatitis B clearance. मतलब आपका हेपेटाइटिस डी तो नहीं है पेशेंट के जो डोनर है। We also for the similarly for organ transplant we are looking for the हेपेटाइटिस बी या सी पॉजिटिव तो नहीं, इनके इस तरह के ट्रांसफर बी और सी के ऑलमोस्ट जीरो है, मतलब डेवलप कंट्री में कि ब्लड ट्रांसफ्यूजन से या ऑर्गन ट्रांसप्लांट से बी या सी डेवलप होगा। ठीक है। सो ट्रीटमेंट विल से क्लिनिकल फीचर अगेन दीज सिम्टम अक्यूट कब विद इन 6 मंथ हो गया 20 to 50% चांसेस होते हैं ना स्पॉन्टेनियस रिजोल्यूशन ऑफ द इन्फेक्शन। In case of B, 95% will resolve automatically. While in C, it is not so. Maximum 20% तक resolve हो, 20 to 50% resolve कैसे होगा? 50 to 80% के तो हो ही सकता है उसके, मिनिमम 50% तो होगा ही। So chronic hepatitis again C जो है it will run an indolent course, slow course होता है। chronic hepatitis है, sometimes for decades, all together 20 साल हो गए साहब hepatitis C है, पहले ट्रीटमेंट नहीं हुआ करता तो वी यूज्ड टू सी पेशेंट हेपेटाइटिस सी ओनली, वी विल मार्क हेपेटाइटिस सी पॉजिटिव, नो ट्रीटमेंट एंड जस्ट ऑब्जर्व। तो ब्लड ट्रांसफ्यूजन के टाइम पे ध्यान देना या डोनर तो नहीं है ये, वी यूज्ड टू गिव अटेंशन फॉर, वी यूज्ड टू सी जॉन्डिस, एक्सपेक्टेड ट्रीटमेंट थोड़ी सपोर्टिव थेरेपी दे दी, नो ट्रीटमेंट फॉर हेपेटाइटिस सी for almost 30 years. Now 10-15 years, now good therapy and very good therapy is available for hepatitis C. So they may also develop glomerular disease, porphyria हो सकता है, ट्यूटेनिया, porphyria, ट्यूटेनिया टायडा, necrotizing vasculitis, lichen planus, lymphoma, diabetes mellitus, other autoimmune disorder भी हो सकता है इन लोगों के। एक्स्ट्रा हेपेटिक मैनिफेस्ट, अपार्ट फ्रॉम हेपेटिक मैनिफेस्टेशन जॉन्डिस के अलावा ये चीज भी हो सकती है उनके। So again टेस्टिंग के लिए आप एंटी हेपेटाइटिस सी वायरस IgM IgG एंटीबॉडी विद सी, पर में IgM या IgG एंटीबॉडी प्रेजेंट भी है, दैट विल नॉट कन्फर द इम्यूनिटी टू, इसका मतलब है पेशेंट अब इम्यून हो गया डिजीज को। हेपेटाइटिस बी में आके IgG एंटीबॉडी आ गई, पेशेंट की इम्यूनिटी आ गई, नाउ इज इम्यून टॉलरेंट, मतलब उसके आप कोई दोबारा इन्फेक्शन होने की किसी और को भी ट्रांसमिट करने की संभावना कम है। लेकिन हेपेटाइटिस सी में अगर IgG आ गई तो इसका मतलब क्रॉनिक 6 महीने पुराना तो हो गया, बट स्टिल ही इज नॉट इम्यून टू द हेपेटाइटिस सी। अगेन हेपेटाइटिस सी का लगा दो तो और ज्यादा हेपेटाइटिस सी होना उसको। सो HCV RNA लेवल बिफोर ट्रीटमेंट वी आर सीइंग, तो कितनी थेरेपी देनी, कब स्टार्ट करें, देयर आर डेफिनेट गाइडलाइंस। जीनोटाइप सब टाइप वही देखते हैं उसको क्या थेरेपी देनी है उसको अकॉर्डिंग टू जीनोटाइप। नाउअडेज आई टोल्ड यू यूनिवर्सल ड्रग कॉम्बिनेशन विद सल्फोस्बुविर, सो 2-3 दवाई मिला के वो दे देते हैं, सल्फोस्बुविर ग्रुप दे दिया आपने तो ही विल बी ओके, यू कैन गो विदाउट जीनोटाइप टेस्टिंग। लिवर बायोप्सी is usually indicated only if you suspect for the liver cancer. E virus again same like A only, it is acute, fecal, and it will remain up to 6 months only, more severe than the hepatitis A। जहाँ जॉन्डिस हेपेटाइटिस में 10 से 15 मिलीग्राम आके रुक जाएगी, वहाँ 15 से ऊपर तो जानी हेपेटाइटिस सी में जा सकती है, 20, 25, 30 तक जा सकती है। पेशेंट में गोइंग टू कर्नेक्टरस, दैट इज कंफ्यूजन एंड encephalopathy, more chances with hepatitis, more common in patients with the pregnancy, then you have to take care। प्रीवियसली कहते थे कि मोर्टेलिटी रेट ज्यादा है हेपेटाइटिस सी के कारण इन प्रेग्नेंट पेशेंट, बट नाउअडेज गुड ट्रीटमेंट, सो good care, so it is not found nowadays, but in pregnant female jaundice please test for the hepatitis E। I think this is enough now।